All right. Thank you very much. For our panel members for today's rich discussion, a big round of applause again, please. For our panelists, thank you. So we've heard how AI can be a valuable tool in strengthening integrity systems and enhancing transparency, but only if we put in place clear safeguards to prevent misuse. The message is clear. Technology alone cannot fight corruption. Policies, institutions, and accountability must lead the way. And as we move forward, let us carry this insight into our next discussion on another pressing issue: how AI intersects with the realities of aging societies. Now, to guide us through Plenary 4, Governing Aging Societies in an Intelligent Era, we are joined by our moderator, kilala bilang ang Profesor ng Bayan, Dr. Ricky Rosales, news anchor at TZMM Radyo Patrol 630 and professor at the Polytechnic University of the Philippines. Dr. Rosales brings a unique perspective as both a journalist and an educator, making him the perfect moderator for this important discussion. Dr. Ricky Rosales, the floor is yours.
Thank you so much, Mimi. Fantastic. And this is the moment where I ask everyone if your brain cells are still working. Unless, of course, if your brain cells are AI powered, then you could feel the same feeling that I have, because since early morning I was sitting there with Dr. Navarro, and there has been a lot of insights, no? And meaningful conversations na I think everyone's benefiting. And this next session is the last, no? And thank you for staying with us. This is Governing Aging Societies in an Intelligent Era, and this also promises a lot of insightful discussions and, you know, meaningful engagement. So we'll start early. You know, population aging poses major challenges for healthcare, pensions, and social services, and AI now is being tested worldwide to support older population, but you know, it raises a lot of issues about access and equality. So our last plenary, an interesting plenary, explores how policies can ensure AI helps, no, in aging societies instead of marginalizing them. So I think this will be very, very interesting for all of us. So let's start. Our first speaker for this final plenary session is a professor of demography at the University of the Philippines. She leads the landmark longitudinal study of aging and healthcare in the Philippines and has published widely on aging, health, and demographic change. Ladies and gentlemen, please welcome Dr. Grace Cruz.
Thank you very much. Good afternoon. Thank you for staying. So this is my presentation. The title is Towards an Inclusive, Tech-Based, Tech-Enabled Future for Aging in the Philippines. Okay, so this is the outline of my presentation. I'll start with the aging of the Philippine population, a little bit of demography, the challenges of aging in the Philippines based on the key findings of our study, the LSAP, and I'll zero in on 3 major areas: economic vulnerability, health and care gaps, digital exclusion, and then I'll move into a discussion on leveraging technology and governance for longer, healthier, more productive lives, and end with some concluding statement. So this is the basis for my presentation. I'll be getting my data from the study that we've conducted, the longitudinal study of aging and health in the Philippines, or LSAP. It's the first nationally representative aging study that is longitudinal conducted in the country, which aims to investigate the health status and well-being of Filipino older people and their correlates. It also aims to assess the determinants of health status and transitions in health status. This project has been going on for 8 years now, and it's being funded by AREA, Economic Research Institute for ASEAN and East Asia, and being implemented by the Demographic Research and Development Foundation. So far, we have collected 2 waves of data. The first in 2018 with about 6,000 respondents with a 94% response rate and followed them up in 2023. So we have data for those who survived to wave 2 as well as those who died in the interim period. Okay, so the Philippines is projected to transition to an aging society before 2030. And this is based on the UN classification that a society is considered to be aging if at least 10% of its population are 60 years and over. And here I show the data using the 2020 based population projections. Under 3 scenarios, we will all of them show that by 2030, about 10% of the country's population will already be 60 years and over. What's interesting to note is that the Philippines is aging before it becomes economically affluent. So the aging of the Philippine population is unfolding alongside the fourth industrial revolution, characterized by rapid technological transformation. So the challenge, therefore, is how can technology and governance be leveraged to ensure longer lives, promote an inclusive, resilient, and tech-empowered future for older Filipinos? So let me walk you through some of our findings from the LSAP Wave 2. The first is their economic vulnerability. So we asked them their sources of income, and we see that older Filipinos have fragile and informal sources of economic support. About 6 out of 10 said their money or financial support come from their children within the country. 54% said from pension, which includes social pension. Earnings from work is quite low, only 1 out of 4, because the employment rate is low among older persons. Money from relatives and children from outside the country is about 18%, which shows us the magnitude of the effect of international labor migration on the economic well-being of older persons. There are other indicators of their economic vulnerability, as shown by the fact that 60% are recipients of the social pension for indigent older Filipinos. 58% also, this is their self-assessed economic well-being, where 58% said that they have some or considerable difficulty in meeting their household expenses. 12% belong to four-piece household, and 7% said that their household experienced hunger 3 months prior to the survey. Health and care gaps are also noted. There's a high prevalence of physician-diagnosed illnesses, particularly hypertension. So hypertension is the most prevalent illness of older persons at the level of 69%, significantly higher among the females than the males. What's more concerning is the fact that 38% are unaware that they have hypertension. 51.5% have untreated hypertension. And 87% have uncontrolled hypertension. We also found in another study that there are missed opportunities for hypertension screening. Another is the information gaps in government health programs for older Filipinos. And here I cite 2 particular programs of the government which provides them free pneumococcal and flu vaccine, where almost half of them are unaware of these government programs, and only 30% said that they have received the vaccination. 23% are aware but did not avail of it, so either this is hesitancy or there's also problem with access, because if you look at the next slide, there is a significant proportion of unmet health needs, and this is mostly due to economic reasons. So we asked them if they felt ill and thought about seeing a doctor but did not in the 12 months prior to the survey. 22% said, and of which 62% said it's mostly due to financial reasons. This is data gathered from the GPS that showing us the average location of the older persons to the nearest health service facility. And we see significant disparities in the proximity of older persons' residents to the nearest health facility. significantly different between rural and urban areas. And if you look at the major island groupings, they're very different as compared to NCR. Care gaps are also very apparent. We all know that in the Philippines, family-based informal caregiving is the dominant form of care. And what's surprising to note is that only 5% of our caregivers, primary caregivers, said they received training in caregiving. Caregiving is highly gendered, with 83% of primary caregivers who are women. And there's a significant difference in spousal caregiving. Among males, older males, they're taken care of mostly by their wives or their daughters. But if you ask the older women, it's really their daughters, 49%. 12% said their daughters-in-law, and only 5% said that they are taken care of by their husband. Okay. Another gap that we saw is the digital exclusion of older persons. Older Filipinos are left behind in the ICT revolution, and this data I show the data from the 2019 ICT survey conducted by PSA and comparing it with the level we gathered at the baseline in 2018 to make them more or less comparable. And we see that 43% of the country's population uses internet at that time, as compared to 6% among older persons. 79% of the country's population uses cell phone, as compared to 30% among older persons who said they own a cell phone. There's also low and highly uneven internet penetration among older Filipinos. We see here significant differences across gender, age group, rural-urban residents, wealth index, which shows us that the richest 20% had 28% internet penetration, as opposed to 0 among the poorest 20%. And there's also an education gradient that we see very clearly there, 36% versus less than 2% among those with elementary education. We all know that the barriers to digital exclusion for older Filipinos includes, among others, affordability. We saw that high poverty levels limit their ability to pay for devices and connectivity. Low ICT literacy, there's limited knowledge and skills. About half of them said that they rely on their children for tech use. And we know very well that this is linked to low education, technophobia, and ageism, among others. We also know that this is likely due to infrastructure gaps, with many areas still lacking reliable internet access. So how do we leverage technology and governance for longer, healthier, more productive lives for older Filipinos? There's a need, first of all, to promote active aging. And here, this involves improving healthcare systems, addressing poverty and education and employment, and promoting healthier lifestyle. Programs and policies should give greater focus on those who are most vulnerable. This includes, among others, the older women, those with functional disabilities and other health needs, individuals with low socioeconomic status who are often with limited education, and those residing in areas with limited access to healthcare and other essential services. We need to bridge the digital divide. We need to promote digital inclusion among Filipino older persons, engage the stakeholders. We need to a collaboration between government, ICT sector, academia, and NGOs, or civil society, improve infrastructure. We need to invest in telecom networks and expand national coverage, ensure equity by bridging the regional connectivity gaps through targeted policies and legislation. At the same time, we have to look at our older persons. We need to empower them through ICT. We need to build their skills and confidence, especially now they are the targets of scams. We hear a lot of old people being targeted for, bank transactions that they are not aware of. We need to show value to them. We need to highlight ICT as a tool to access information, health services, and improve their well-being. We need training, offer tailored hands-on ICT and telehealth training for older persons, and leverage intergenerational support. by incentivizing younger household members to guide the older persons in digital learning. We need to strengthen health and care systems with technology and training. We should employ technology to improve health systems. We already have a lot of this development in the developed world, the aging world. They use voice-activated devices, for instance, for medication reminders and health monitoring. Especially, they're likely to forget the schedule of their medicines, when to take them, implement remote care, enable tech-based caregiving and monitoring to support caregivers, and fill care gaps. We also need to integrate gerontology training. We need to embed gerontology and elder care in medical health and social science curricula. So we also need to design inclusive institutions, amplify older persons' voices by involving them in program and policy design through participatory decision-making, ensure fair resource allocation by promoting equity in funding and services for older people, and build monitoring systems. There's need for research like the LSAP to track and evaluate the impact of tech-based well-being initiatives. So as in conclusion, population aging is the Philippines' next major demographic challenge. Let's turn longevity into a silver dividend by investing in health programs, data, technology, and inclusive governance. So these are the two reports from the LSAP. We can download the Wave 1 report, and the data are now available for those who are interested, and the Wave 2 is also available online. Thank you very much.
Thank you very much, Dr. Cruz. Our next speaker is a professor of medicine at the UP College of Medicine and the founding director of the Institute on Aging, UP Manila NIH. A board-certified geriatrician trained at Harvard Medical School. She has pioneered geriatric programs in the Philippines, including the outpatient clinic at the Philippine General Hospital, and continues to shape policy and practice on healthy aging and dementia care. Please welcome Dr. Shelley de la Vega.
Thank you very much to the aging population. And I'm quite sure that you're all interested because everyone is aging. And I thank Dr. Grace Cruz, whom I have been working with in many of our researches, because I'm going to add a little bit more detail on the health and systems needs and introduce the term geron technology. So let's start. My slide. Thank you. So let's flash my slide. The objectives of my talk include, first, to describe healthy aging, because that's the main goal, to be able to achieve functionality and well-being. And then, of course, present interdisciplinary, sociocultural, and medical solutions based on our researches on healthy aging and health systems, with emphasis on enhancing social connectedness, individualized patient-centered care, and AI solutions to employment. No? And of course, describe some geron technology innovations. Thank you. Okay. All right, so what is healthy aging? It is the process of developing and maintaining the functional ability that enables well-being in old age. It's not the absence of disease. It's being able to do what we want to do and achieve despite the disabilities that we have as we age. And so this is the framework that we are going to use and what we used in our study, and that is genetics is at the center of it, but it's only 30% of what determines how we age. No? What determines how we age is influenced by our health characteristics, our experiences in the health system, for example, which also is described in my study, and that includes the environment. Now, because the environment, if it is supportive, will allow you to remain functional for as long as you can. So you need all of that now for healthy aging. Now, our studies are the UP-WISE, funded by the EIDR UP system, and the Fit for Frail, funded by DOH and managed by PCHRD. So this is the framework that I'm going to talk to you about. I'm going to look at, we are going to talk about intrinsic aging, which really how we age. It's how we age as we grow old, no? But also describe how the health environment is and the health systems is and how we can improve, no, the way we age in the country. So very basic, social isolation is one of the things that we looked at. And this was very important, especially during the COVID. And we realized that before the COVID erupted, we already had this data and we were already sharing it with the DOH. And we said, 4.2% were living alone. Where are the older people that we are going to vaccinate? And we had no data, right? We could not find them because local government units did not have a good listing of those senior citizens. And we also knew that 15.6% needed a primary caregiver, meaning they needed someone to assist them in their activities of daily living, such as toileting, for example. But in 2013, I also wanted to ask, what is the quality of life of older Filipinos? And this is just a small study, which translated the WHO QOL, or Quality of Life short version. And in that study, in the NCR, we determined that most had good to moderate quality of life. There was just one woman who had very poor quality of life, and that is because she lived with her daughter and her son-in-law was very abusive to her daughter. That was the only reason. But it showed us that the quality of life of an older person also dependent on the social milieu where she was. And when we asked them, because there is a question in quality of life about economics now, if you have the money, if you are able to earn, how will you use that money? And many of them answered, ibibigay ko sa aking mga apo. Can you believe that, no? How generous. Now, looking back now at our study and describing diseases and injuries, which we will call intrinsic capacity based on our framework, we noticed that there is a little bit of difference between the geriatrician diagnosed illness, the top 5, mainly error of refraction, visual impairment to your life, hypertension, osteoarthritis, sleep disorder, and cognitive impairment, versus the usual non-communicable diseases that we hear from many of our demographers and health statisticians. And these are NCDs, such as hypertension, osteoarthritis, sleep disorders, and cognitive impairment, and depression. But in both ways of analyzing, we see that sleep disorders and depression and cognitive impairment are also there, high up in the top 5. And that's very important for many of us. Now, there was also some difference between the geriatrician diagnosed medical conditions versus what the patient knew she or he had. And there was a great difference in the report of malabo ang mata or presbyopia, probably because many older people think it's part of aging and they did not recognize it as a disease state. As well as, of course, osteoarthritis, they did not report that as a disease versus the geriatrician diagnosed osteoarthritis because probably they thought, matanda na ako, talagang masakit na ang tuhod ko, therefore it's not a disease. So there's such a difference. Now, a very important difference that we looked at was the difference in how mental health and well-being states were reported. A lot of people said, no, in yellow, that they had sleep disorders, hindi makatulog. But to a geriatrician, it was not really insomnia, but that was part of the aging process. But look at cognitive impairment. Very few knew that they had cognitive impairment, when in fact, close to a quarter had already the risk for dementia or cognitive impairment. Depression, again, probably there was more subjective reports of depression versus diagnosed depression. Going to dementia, a lot of people thought they had dementia. Kalimutin na ako, Dok. dementia na ako, but truly, only 9.1% had diagnosed dementia, of which 3.2% was Alzheimer's. No? Anxiety was also more highly reported than diagnosed. So, because we had this data and because we also have some data on health systems, including the number of healthcare providers, psychologists, health systems for mental health, we came up with this infographic, which we had shared in many of our fora, that recommends really that we should have more trained psychologists in our centers and in many parts of the country so that we can take care of mental health. And true enough, during COVID, there was an eruption of mental health problems. Now, looking at syndromes, ano ba yung syndromes? Syndromes are very complex, no? These are not diagnoses per se as we know it, hypertension, depression, no. But these are things that have multiple causes. And what we found out was the number one geriatric syndrome is the risk of falling. And followed by sleep disorder, depression, dementia, urinary incontinence, and polypharmacy or too many medicines. Now for women, depression and dementia were quite high compared to men. Now, let's look at the environments because it's important. Like I said, in our healthy aging framework, we need a supportive environment. And these are some of the things that we looked at. No? So if you have a supportive environment, your functional ability can be sustained despite the natural decline in intrinsic capacity. And so we looked at the health system building blocks. I'm not going to discuss everything here, but health service delivery was available if the LGU had a geriatric program. No? But not all LGUs still have geriatric programs available. Most are outpatient. Only 19% of geriatric centers had a functioning ward, and mostly the services were available in hospitals, not so much in primary care centers. And only 52% of the hospitals offered a comprehensive geriatric assessment, which allows us to identify the syndromes that I mentioned earlier. Now, for the workforce, of course, very few had training in geriatrics or gerontology, except for nurses and doctors. So we still have a lot of legwork to do when it comes to training. So we came up with a health human resource infographic. Here it is. These are our recommendations. Primarily because, for example, geriatricians are mostly in the NCR. No? And there are only 155 of us who are board certified. So we need to train more, even generalists, how to take care of older people. Now, dementia is one of the things that we help disseminate through online courses. And this is available online through the link below. And it is available, and we also have YouTube versions and a webinar series that you can look at for free. And we have been doing health workforce capacity building with PCHRD. So health information systems, that is going to be discussed in detail by the next speaker. But of course, there is poor interoperability. Many data systems are not able to talk to each other. That's it. No? Because there are so many versions of it, and these are some of our recommendations. Social structure, it's a good thing that most have family support, no? And they perceive the system, the environment in the communities to be age-friendly. But again, of course, a small portion, about less than a third, reported some amount of physical and emotional abuse. So what is an age-friendly environment? It has to have social support, protection from violence and abuse, education and literacy that allows volunteerism, mentoring, and visiting by other older people. There has to be accessibility, and it's not just about ramps, no, but accessibility to doctors, to vaccines, to products, and spaces to walk and be active. So we did a review of some available smart cities all over the world, and there really is a lot of innovation in Japan. No? Hitachi, for example, Kobe, China, and here in Pasig City, the JICA has a cooperation program that you can download and look at for details. but the WHO WIPRO has several case studies on action plans for healthy aging in many countries. And I'm just going to mention that in China, they already have a national medium and long-term care plan for active response to population aging, something that we have yet to have in the Philippines, for long-term care specifically. Japan definitely already has a long-term care system. In fact, they already have an insurance system that has been around for almost 20 years. Again, something that we direly need. Now, the National Commission of Senior Citizens is trying to create a system that is interoperable in many of our LGUs. Now, just for gerontechnology, this is our review. And the number one gerontechnology, meaning technology for older people, is health and safety, direct care, social connectedness, mobility, recreation, and health information systems. And these are some of the examples. Of course, many of us have our own BP monitoring devices, wearables, medical alert systems. In the University of the Philippines, we now have a system, virtual reality, Oculus, it's called a VR system that allows interaction, so that it's now being experimented on for patients with dementia. And of course, direct care, there is telehealth. Many of you probably get in touch with your doctors through telehealth now, and pill dispensing systems. Electronic medical records are very important and have yet to be developed. Now, home safety, very important. As you enter the home, it has to be safe for older people. Mobility, of course, there are various chairs and lifts. In DLSU, they now have the Agapay exoskeleton, right, that can help people with mobility problems. Now, with regards to social connectedness, the Filipinos, are older people, are very much, well, this is USAARP. And in the US, they use Facebook and YouTube. Now, for long-term care, which is very important. Now, we have to look at long-term care because as we grow more dependent, we need to have long-term care systems. Unfortunately, this is not yet fully into a policy in the Philippines, but we did have a system, long-term care system study that identified several problems or challenges. For example, we have yet to have guidelines and standards for our nursing homes. Many have built nursing homes, but there are no quality standards. And of course, aside from equipment, facility, funding, we need to have a local national policy for long-term care. So we do recommend, number one, a national policy on long-term care, and eventually a long-term care insurance system. So this is a study in the University of the Philippines of our own retired employees, and many of them wanted to still continue to work beyond retirement. And there really is a public employment service office. But for you to be able to log in, you have to be well-versed in the internet. So it's very difficult for older people. But there are some things that can be developed in order to improve the retirement programs. Okay, so universal health care, we are now talking to PhilHealth because they now have a YAKAP program, but they still don't have one that is specific for older person. That's why we are recommending the comprehensive geriatric assessment, which involves a 10-minute screening, and if you're positive for that, to go into the more thorough evaluation. So finally, before I end, we need to have more research, such as what Dr. Grace Cruz had mentioned, more research on aging, a unified agenda, more funding, research harmonization, and human resource for aging research. Thank you very much from the Institute on Aging.
Thank you very much, Dr. De La Vega, for another insightful presentation. Now, our final speaker in this plenary is a Research Assistant Professor 2 at the Institute on Aging, National Institutes of Health, UP Manila. A public health nurse with an MPH, she leads studies on geriatric assessment, dementia, frailty and health systems for older persons in the Philippines. And she has also contributed to policy development for senior citizens and participated in international training on technology and aging. A warm welcome to Ms. Angely Garcia.
So good afternoon. I'll be presenting, or I'll be sharing our works related to governing health data of older persons in the age of AI. I'll also share other related works related to AI, aging, and digital and data governance. Okay. Yeah. So the aim of this quick lecture is to introduce what data governance is in the context of healthcare of older persons. So we've been hearing data governance since this morning. So maybe we can dig deeper in the context of health and aging. So we will also discuss research findings related to older persons, health, AI, and data governance. And I'll be sharing some recommendations from based on the literature to address challenges related to AI and data governance. So what is data governance? So it's a set of practices for making decisions about data and for managing data throughout its life cycle. So this is to optimize the capability to use data to generate information in order to inform policy, strategy, and operational management. So any organizations that collect, use, manage, or utilize data should implement data governance practices. In order to plan and in order to implement and improve data governance, organizations should consider different components, namely the persons or the people, the technology, and the processes. So who should collect the data? So that's the people. What are their roles and responsibilities? In terms of processes, what are the processes that will be used to aggregate or to analyze these data or to dispose these data? And for the technology, what tools will be used to secure these data? So that's some of the examples for the core components of data governance. So why do we need data governance in the context of older persons? So we know older persons have a lot of comorbidities or diseases, just like what Dr. Cruz and Dr. Shelley presented. So they have complex problems. They have different health data. For example, their medical histories, medications, the different health settings that they are visiting, their different healthcare providers. So the data of older persons are complex. So data governance is needed, especially for these vulnerable age groups. So data governance is also important to inform policy, strategy, operational, and clinical decision making. So this helps the healthcare providers of older persons to formulate interventions and manage their conditions. And also, it is important, data governance is important to maximize the benefits of their data. And lastly, to prioritize investments, establish policy, protect data and information assets, and determine accountability and processes. So to your right is the data governance functions throughout the life cycle. So this outline what data governance what are the functions of data governance? Namely, defining accountability, prioritizing investment, establish policy, implement processes, set standards, manage risks, and monitor performance. So we are hearing this since this morning. And for the data life cycle, so we know that data starts when it is collected. So data collection, then data aggregation, data quality, data storage, data protection, data access and use and disclosure, and lastly, data retention and destruction. So these include the retention schedules, the destruction methods that will be used. So these should be defined by organizations that collects or manage data. So this, in terms of health, so this is the data governance framework in public health by the Pan-American Health Organization, which is a high-level framework for implementing data governance in public health. So as mentioned earlier, these are the components: the people, the process, and technology. So under people, the decision-making structure, the roles and responsibilities, and the communication and transparency should be defined. And for the process, the data asset management, the standard operating procedures, and the standard policy management should also be identified. Moreover, for the technology, the different tools and technology, the quality, availability, and security, as well as the performance on how these systems should be monitored, should also be defined in the data governance policy or framework that will be implemented by such organizations. Okay, so as part of my graduate study, so and also recognizing that data governance and in terms of healthcare of older persons is underexplored, we conducted a scoping review to synthesize available information on health data governance in the context of older persons. So we visited 6 online databases from 2022 to 2024, but the coverage period is 2000 up to 2024. And we utilized the earlier framework for the analysis. So of the more than 9,000 identified titles, we've included 57 papers in the review. So of these papers included, most of these papers actually focus on technology and processes, and only a few focus on people. Who are these people? What are their roles and responsibilities? These are limited in terms of this context. We also found that data controllers, the processors, the researchers, data subjects or patients, including their family or relatives, and relevant organizations were involved in older persons' data governance. So data controller are those agencies or people that are setting the standards or setting the policies on what is the purpose of collecting this data. So those are the data controls. And then the data processors are those entities that process the data that were collected from the data subjects or the patients. So in terms of the framework analysis for the data governance in the healthcare of older persons based from the scoping review, so we found that in designing and implementing data governance for older persons, the following are key components. So one, there's a need to review the evidence and existing regulatory frameworks. Second, involve all relevant stakeholders in defining their roles and accountabilities or responsibilities rather, and implement specific processes following the focus issue. For example, if fall detection is the issue, then implement such processes to address this. And lastly, in designing and implementing data governance, testing and monitoring the framework should be done. So following the components, so we found that there's no articles in terms of communication and transparency, standards and policy management, quality, availability, and security, as well as monitoring performance. So I think this is the gaps that we've identified. So further research should be conducted in terms of these aspects. So in terms of AI healthcare of older persons, these are some of the AI technologies that were covered by the scoping review. So some examples of AI for older persons include neural network modeling for early detection of Parkinson's disease, for timely management and delay the progression of the disease. And then AI was also used to process cardiac images, detect and classify manage chronic diseases, and monitor health of older persons to provide decision support to clinicians and community nurses. Also, there's an interactive self-assessment tool on the utilization of AI technologies for aging and healthcare. In the Philippines, so there was a limited search, so only the 3 studies that are related to AI and healthcare of older persons were found. So this include the machine learning analysis on social dynamics in the elderly and population, a pilot study, a Boon Bain for senior citizens, and theologizing on AI in elderly care. So AI for senior citizens is a boon based on the study. However, it highlights that the human interaction cannot be replaced by AI. Same with the findings from theologizing on AI in elderly care. It also underscores that AI cannot replace the human connection. In terms of challenges in AI in OP's healthcare, so some were already discussed earlier. So digital divide, digital exclusion, and more importantly, the most common issue related to AI use is the data privacy concerns, violation of data privacy and autonomy. AI model bias. So there are AI systems that do not consider or did not use data of older persons in training those AI systems. So that's already a bias. You cannot apply an AI system for older persons if it was not trained or it did not use data from the older persons. And then absence of external validation among older persons. This is also a concern. And safety issues in home environment, especially for those related to sensors and cameras. And then inadequate transparency. So this was highlighted by some other studies. They mentioned that how these AI systems or how their algorithms come up with such predictions are not clear. So they are not transparent on what data they use to train these AI systems, their algorithms. So the transparency was inadequate. So in the Philippines, so these are the digital transformation related to older persons. So the online registration of senior citizens with the National Commission of Senior Citizens in partnership with other organizations. So the online registration of NCSC include the senior citizen data form, which include a lot of personal and health information, as well as economic and skill set information of older persons. Second is the digital identification system, or the digital national ID, recently launched by the NCSE in partnership with DICT. So in terms of AI in healthcare in the Philippines, general, so AI adoption in healthcare in the country is in its infancy stage and limited in coverage areas such as NCR and Cebu. AI applications that are used in medicine or in healthcare include telemedicine, medical imaging analysis and predictive analysis. And as mentioned earlier, there is a national AI strategy roadmap which aims to improve healthcare delivery and outcomes. So some barriers also in terms of AI adoption and implementation include the workforce limitations, the personnel in charge of this AI systems are limited. And then, of course, the internet connectivity, especially in the Philippines. So we cannot assure that each area has the same connection. And then data collection, representation, and accessibility. This is also related with the AI bias. And then limitations in infrastructure, digital infrastructure specifically. And then education and public understanding of what AI is and what AI can do. So in summary, so the Philippines has initiatives towards digital transformation for older persons. However, there are various challenges associated with AI on older persons. And the country is in its infancy stage in terms of adoption and implementation of AI in healthcare. So barriers to AI adoption and implementation exist. With this, a well-designed data governance, which considers the essential components, the person, process, and technology, the functions and principles should be developed and implemented to optimize the utility of data in improving the health of older persons. So these are some of the recommendations in governing data of older persons in the age of AI. So again, relevant stakeholders should consider key health data governance principles and incorporate them into the national standards and legislations. So these principles include protecting the people, promoting health value, and prioritizing equity. Investments in AI infrastructure and digital literacy to ensure that the public understand what AI can do, and AI development and deployment guided by ethical framework and robust technological infrastructures, AI fairness, transparency, balance between human experts and models. So there should always be human intervention. So we cannot just let AI do our work. So there should also be human interventions as well as, especially in terms of healthcare, because safety is also an issue. And then further research on data governance and AI for older persons are needed to inform policies and practice and enhance health outcomes. So I think that's my last slide. So these are my references, and thank you for your attention.
Thank you, Ms. Angely Garcia. Thank you also to Dr. Shelley and Dr. Grace. At this point, let me invite our discussant to share her insights from the presentations. She is a retired professor of educational psychology at the UP College of Education, a multi-awarded teacher, and a prolific author. She trained at Harvard University and will soon release her 14th book, Aging with Grace and Courage. Please welcome Dr. Grace Shangkwan Koo.
Hello. So much data, huh? No more data in this talk. Dataism is the new religion, right? So how do we deal with this new religion of dataism? So my task as a discussant is to select one of their talks, but I'm selecting all of those talks. They come from the same UP Manila study. So I'm going to look at AI and aging. When I received that invitation many months ago, maybe 2 months ago, I thought, AI and aging. I probably represent aging. I just retired from UP after teaching doctoral studies for so many years. And my book was, my 14th book was published last week at the International Book Fair, Aging with Grace and Courage. So maybe I can be an subject for their experiment next time. So aging and AI, do they come together? So today I'm going to look at a few things, the nature and features of AI and technology by quoting much from Yuval Noah Harari, if you know him. And then, can AI cure aging? They seem to suggest that we can, right? From the doctors and the nurses. And I'm suggesting for an interdisciplinary conversation about AI and technology. And then AI in the light of our mortality and eternity. So I'm going to be very brief and very quick. I hope that we get to know something from here, because I taught at UP, the ecology of human development, and on the subjects of technology, I would always quote from Noah Yuval Harari, and from his 3 books. I read all his books. I wanted to just summarize in 10 points very quickly. What is his view on technology? Number 1, techno-god. Dataism is our new religion. To increase the flow of information is the greatest good. He who owns the most data rules the world. Do you agree to that? Number 2, human brain is hackable. Oh, they don't need to look at your computer or your cell phone. Your brain is the computer that is the most hackable. And why is that? People trust algorithms more than their own feelings. They rely more on Google for answers, which will decide who will be accepted to the university, what to study, whom to marry. Algorithm is the archangel of this religion. The artificial intelligence humans created would now transform human nature. Now, my background has to do a lot with philosophy, psychology, and theology. So I'm going to, for us to dig deeper into how AI has transformed us. So algorithm know me better than I know myself. Do you ever wonder why in the morning when you turn on your cell phone or your computer, it has already suggested what you have to read, your likes, what you have been searching all these years. So they know me better sometimes than I know. Algorithms can manipulate my feelings and emotions, which predict my decisions. We will become completely reliant on technology and algorithms. Technology will eventually be the decision makers. I have the privilege to be the last speaker today. So I don't mind if you have not had enough appreciation, I'm sure you did, of data and algorithm. So let me just be the devil's advocate for a while, and let us look at how technology will eventually be the decision makers. Data will destroy human freedom. Intelligence is uncoupled from consciousness. Whoever leads the world in AI and controls the data will dominate the entire world. And then there's the danger, and maybe it's a blessing and a bane, actually. The merger of infotech and biotech. So do you want your DNA to be changed, manipulated, genetic? Yeah, we can do that eventually. In year 2050, pregnancies can be terminated. So without our understanding of dataism and its importance, let us also look at the other side of data. So the machines used to have just physical ability. Now it possesses mental ability. So many people will be out of jobs. In fact, some of us have already been out of jobs because of artificial intelligence. The pace of change is quicker than our consciousness, maybe quicker than our evolution. AI reads biometrics of brain, blood, and heart. There's no need to go to the doctor sometimes to have this examined. Medical education takes 10 years, but AI can produce infinite numbers of doctors very quickly. And what job markets will be in 2050? What to teach in schools? What we teach today is no longer relevant in 5 years' time. So I was teaching at UP for 25 years. At the start of those years, I had to buy myself a lot of books. And make notes. These days, you don't have to buy books. Everything is in the internet. And you better outpace your students in reading. You don't possess the knowledge anymore. So, how can AI cure aging, or how does AI reverse aging? Of course, it can enhance our biological age prediction, identify patterns in cellular process, accelerating drug discovery. There's a leap of drugs so quickly discovered, enabling precision medicine of personalized anti-aging strategies by cellular reprogramming. And I was having breakfast with someone who's very rich at her house in Forbes, and she brought out her little medicine can. There were 15 pills she had to take in during breakfast. But she does look very young, considering that she was older than me by 15 years. Anti-aging pills. Wow. Would you like to have some of those? Maybe our UP Manila faculty would do that. So I'd like to suggest 5 areas to discuss about aging in relationship to AI's contribution. We talk so much about epidemiology or biology of aging. We do have to also talk about psychology of aging, sociology of aging, psychology of aging. Who am I? Who am I? Am I the person in the social media, or here or there? We can be anybody, anytime. Sociology of aging. Do people still have community? For the aged, the philosophy of aging. What's the purpose of life? What's the purpose of life? At the end of today, what is the meaning of life? We heard so much about data. But I'm so glad I'm done with my research requirement at UP. The philosophy of aging, even more, the spirituality of aging. Aging with grace and courage. Why courage? Because we are afraid of aging. And aging brings death. The spirituality of aging is sometimes more important than the technology of aging. So, even Bill Gates listened to Harari, and he asked this question, who am I? What if one day whatever gives us meaning went away? What would we do then? In the silence of the night, what is the meaning of life? We have data explosion everywhere. And because Harari said discontinuity will be the most salient feature of human beings. So I read a few books that were so meaningful to me. One was Harris Lewis' Excellence Without a Soul. He was the Yale Dean of the Computer Science. Another is by Anthony Kronman. His book was called Education's End, because I'm educator. Why universities are giving up the meaning of life. He was the Harvard Dean of Law. So I want to show what he said. Technology can extend life, but it cannot cancel death. Technology discourages the thought that our finitude is a condition of the meaninglessness of our lives. Technology gratifies our desires for control. Technology obscures the truth about us. One of the consequences of our technology is the repression of our mortality. We forget that we are mortal. So we must learn to attend once more to our mortality. So at UP, in my philosophy class, we do an exercise called memento mori. You probably have heard about that. Since Socrates, we have to always remember. Memento mori means remember, you must die. It is the ancient practice of reflection on our mortality. So they bring a skull on their desk, put it on the desk. So every day they would know that there's mortality. And why are these educators worried about technology? It has pulled away completely humanities. So I wrote quite a number of articles at Philippine Daily Inquirer. I used to be writing for the learning section, and before that, lifestyle section. Why we are giving up on humanities? Technology cannot teach us compassion, empathy, emotional intelligence. So I end up with this favorite, Psalm 90. Lord, you have been our dwelling place throughout all generations. Before the mountains were born, or you brought forth the whole world, from everlasting to everlasting, you are God. And it talks about both aging and AI. I will tell you why. Verse 12 says, "Teach us to number our days aright, that we may gain a heart of wisdom." Wisdom in aging. And AI in verse 17. "Look upon us with favor, Lord. Establish the work of our hands." Yes, establish the work of our hands. Because this verse 1 contrasts human beings from God, dust to dust. We are like grass. In the morning, we are blooming. In the evening, we are withering. And the length of our days is just like a moan, a sigh. 70 years, the normal years. But Lord, look upon us. Establish the work of our hands. More importantly, let us understand aging. Teach us to number our days aright, that we may gain a heart of wisdom. Thank you very much.
Thank you so much, Dr. Grace Ko. What a way to end the presentation, last presentation. May we invite Dr. Grace, Dr. Shelley, and Ms. Angely to come up on stage. In the interest of time, I was informed by the organizer, I'll just throw one question for you, and then I'll allow our audience to have questions. Now, in case you have questions, the organizers have this fire chat, right? And you can ask questions outside the hall. All right. This one question, I think I can throw this to everyone, because I think it was already echoed as well by Secretary R.C. Balisacan in the morning, that by 2030, based on data, 10% of the population will be 60 years above. So my question is, given, since the morning we have been talking a lot about artificial intelligence, the challenges that we have in the Philippines. A while ago, we were grounded on the realities in Philippine society by Ms. Heidi Mendoza. My question is, how do you imagine Philippine society in 2030, given all of these conditions that we talked about, particularly within the context of our aging population? By the way, we have two Graces in the in the panel right now.
Yeah, the other day I read that in Japan, do you know how many centenarians they have? 100,000. Can you imagine? 100,000 centenarians. If we can just catch up a bit with even just Hong Kong, because Hong Kong, all the old people are walking around because the infrastructure is good. There is public transportation, and there is a very easy walkway to this transportation. If for the Philippines, even if we just catch up with our Asian neighbors in making our infrastructure, highways very comfortable, then I would foresee that there will be more old people walking about. Because here in Manila, I seldom see them walking about on the streets except at the mall. So if we can allow for our infrastructure to catch up, I'm sure it will be a great addition, a great a contribution to our aging population.
So can you imagine it by 2030 happening?
5 years time, maybe just in BGC.
Dr. Grace, maybe first.
Yeah. So I don't think it will be that grim a scenario. In Japan, I know that 1 out of 4, if you go there, would be an aging person, right? Because of the very rapid aging in that country, because of their sudden drop in fertility. And of course, it's also good news that we're living longer lives now because we have reduced death and therefore we're extending our lives, right? So that's good news in a way. It's achievement of humanity that we have conquered deaths, both in the infancy stage and reducing the death rate among older persons by modern medicine, so we're able to extend our lives. So if you go by the projections of PSA, there will be about 11 million older persons by 2030. That's like twice the size of Singapore.
Wow.
So I think that's a unique characteristic of our aging process. It's slow, but we have to take care because the magnitude is huge. We have a high number of people who will be aging, and it's going to be more rapid into the future because of the decline in our fertility in recent years. So the age structural change will be very rapid. In fact, if you compare the speed of aging in the developed world as compared to the developing countries, there's a very stark difference. Ours will be a more rapid rate of aging because of the rapid decline in fertility. And of course, we have imported all their medical technology, so we're able to extend our lives. And I think the issue now is, are we going to live longer and healthier lives?
Yes.
And I think that's a challenge because we don't want to live longer in disability.
Yeah.
Those additional years should be years. That's why they say we have to add more life to years, right? So I think that's a challenge. And I hope that in 2030, that's 5 years from now, and then, we have to go beyond 2030 and imagine that there will be more and more older person, and that would also mean that the older persons will become a political force, like in other. They will have to listen to the older person because demographically there will be more of them increasing over time. So that's a scenario, and it's not new because we just have to look at what's happening in the developed world. And I think that's the advantage that we are aging slower than the others, and we have a lot of experience from the developed world that we can learn from. And yeah, so we can imagine by looking at Japan, but it will not be as fast.
It's a model.
Okay.
Hello. I imagine that an effective data governance framework is in place wherein it is integrated into different settings of care, from the community to the hospitals and the long-term care institutions, perhaps, so that the older person will not face any difficulty in terms of accessing different health services, for example, consultations or purchase of medicines or performing diagnostic exams. So in just one click or one click in a QR code of the older person, his or her information can be accessed, and provided that this governance framework consider the use of consider the ethical use and applicability of its
Ms. Angela, I just have a follow-up question before I go to Doc Shelley. You have heard Ms. Heidi Mendoza kanina saying that the data governance of the
Fragmented.
Philippines is fragmented more than our politicians. Any insight on that? Because you are researching particularly for
Yes.
public health. Any insight on that?
For the older person, so Dr. Shelley mentioned earlier the health information system in terms of the context of older persons. So we did the study, and then we found that the data of older persons are actually, yes, fragmented. These can be found in the health centers, the
It's the
community, in different drugstores, in different diagnostic providers, in hospitals, in long-term care institutions. So these are separate, and we cannot have insights to inform policies or programs if these are fragmented. So that's why I am hopeful that there should be
Does it include
a
in
data
your
governance.
suggestion for
Yes,
policy?
yes. For future
Yeah.
research on the data governance for older persons.
Right.
Because we need to understand first how can these be integrated in each system. Because, for example, the provision of services in the community is different from what the services in hospitals are being provided, from what services are being provided in long-term care. So we need to understand more so that we can craft recommendations that are responsive to these challenges.
Thank you.
So thank
Doc Shelley, one
Yes.
insight, please.
It's an aspiration. The vision of the Institute on Aging is of the Filipino person, healthy in body, mind, and spirit, being treated with dignity and valued as a productive member of society in a dynamic process unique to him or herself and beginning a life of unlimited possibilities. And that is what we are trying to understand and achieve. Healthy body, mind, and spirit. Technology is there. Science is there. There will come a time when our lifespan will be the same as our life expectancy. Can you believe all of us living to 120? Or maybe even to 800 years. Because we are now in genetics and we are looking at the minuscule parts of our cells. And it might happen. It's already happening in invertebrates and in some vertebrates, but it will happen. So imagine yourselves as an 800-year-old.
Wow.
And then,
imagining.
but then treated with dignity and
Yes.
value.
Yes.
That is where we need to understand how the environment, systems, policy, structure can help us achieve that. Because what's the sense of living to 800 if you're not able to be with your loved ones, if you're not able to communicate meaningfully with each other, okay?
Agreed.
And beginning a life of unlimited possibilities. And that is where research, discovery comes in. We still have to continue discovering things. It's going to be a good world.
Yeah.
That's what I think. And technology will help us achieve it.
Okay. Now, we will now start to entertain question from, yes, sir, please. Your name first and organization.
Hello, yeah, sorry. Thank you very much. Diego Maranan from the University of the Philippines Intelligence Systems Center and also the Open University. I just wanted to signal our deep interest in working in the area of intelligent systems, AI, data science, complexity science, and aging. How can we age better? How can we age more gracefully, but also how can we die more gracefully as well? I think mortality is this thing that's, it's there, but we can. Anyway, my question is, to what extent do you think that AI and technologies can help mainstream gerontological expertise? To what extent, we know, for example, that people are using Gen AI as proxy therapists to help them parang solve individual problems, make sense of their lives. Can it possibly, parang with all the caveats around hallucinations, misinformation, can Gen AI be used by ordinary people potentially to help care for aging loved ones better in their own homes? Thank you.
Mr. Maranan, the Institute on Aging will be in the UP Open University in November
Fantastic.
to hold a healthy aging conference.
Wow.
And we are inviting all of you. It's going to be mostly free because fortunately PCHRD, hopefully, and the UP system will be funding part of it. But we will be discussing
Precisely
things
that.
that you are asking now. The generation of older people 10 and 15 and 20 years from now will be different from the generation now. They will be highly able to use and understand AI. And just like us, I think AI will improve over the years. We need people to govern AI. That's the only thing that is necessary. But definitely, AI is here. It's already helping us in caring for older people as, for example, geron technology. But maybe you also have answers.
Okay, I would like to add that, for example, in NLPs or chatbots can be used to educate the lay or the carers on how to take care of older persons, provided that the data that will be used to train the system will come from the experts or evidence base. So yeah, there is a potential in that aspect. So thank you.
I watch quite a number of NHK documentaries, and they have robots, feeding the old people and making sure they take their medicine and so on, and carrying them because they have to learn how to carry the old people. So Japan is way ahead in gerontology and geriatrics, so they are doing very well. In terms of AI and chatbots, and I was in China, in Xinjiang, and there was this child, about 5 or 6, talking with an AI. Chatting and chatting. We are traveling, and we are going to the lake, and here was this woman whose voice was very gentle. How are you doing? Tell me something about what you see, and so on. Yeah, and this boy was so enamored by this mother figure or a sister figure, and he was not paying attention, and the shuttle bus swerved, and he fell, and his real mother is behind her. His real mother was behind him, and you see, the real mother is very harsh, but the virtual mother is very gentle.
Very gentle.
So I wonder which is the real mother here.
I just want to add that, like in the case of Japan, the reason why they're turning to robotics is because of the changing age structure. They don't have enough caregivers. And you can imagine the future with a significant decline in fertility, what will be the scenario. In the Philippines, for example, we're now below replacement fertility. In a generation's time, where will we get our caregivers? Right now, we are also facing the reality of international labor migration that's dominated by women who are the traditional caregivers. So if this trend continues, because the demand is high in the aging society, they love the Filipinos who are caring for all of their elderly there, but who will take care of our older persons? I think those are the things that we need to consider. And of course, we say robotics will have to come in and assist in the caregiving, but I don't think there's a substitute. They will be sufficient substitute
Right.
for the human.
I know,
care.
Mr. Moranan, you have another follow-up question. Maybe you can wait for for Dr. Grace's team to go to UP. You said you will be in
Please.
UP or US.
UP Open University,
It's out of-
November 22.
It's not a question, but a Joni Mitchell quote who sang, "Who are you going to get to do the dirty work when all the slaves are free?" And that reminds, yeah. Thank you.
Thank you, thank you. We have another question here. Yes, sir, please.
Hi, good
Name and-
afternoon. Nick Sanchez from the Philippine Consortium. I'm a social worker and AI entrepreneur. 3 points. First, as you mentioned, healthy aging, graceful aging. What concept will you recommend for the government to adopt as part of its vision for our Filipino elderly? The second question is, you mentioned about life expectancy. According to the World Health Organization, the Philippines is the country which is life expectancy is going down compared to other countries. Thirdly is, the most important question here is, what's your recommendations for senior citizens who will attend the September 21 event?
Okay. We are now adopting in the Department of Health, healthy aging. We are in the decade of healthy aging. We're following the WHO framework. So that is why I discussed healthy aging. So that's the answer to number 1. But there was one report in 2022 saying that the life expectancy of the Philippines declined compared to most of the WIPRO countries. No? We think it's because of COVID. We hope that will be corrected in a few years. But for sure, our life expectancy will be increasing because there'll be fewer children, just mathematically. Dr. Grace.
Yeah. So that is an artifact of the COVID. So we in 2022, based on our projections of life expectancy, it declined by 1.8 years, but we were able to rebound. So we lost 1.8, but we were able to rebound because, COVID is no longer there, which is the major cause of that reduction in. I think as of 2025, the life expectancy for women is 75. That means that if you were born now, that will be your expected life expectancy. But for us who were born in the 60s, 50s, you have a shorter life expectancy. And of course, they're saying 60 is the new 40 because if you look at decades ago, if you're 60, there's like just 5 more years before you die. But now, if you're 60, you have like 20 years more. So that's why there's now a move towards extending retirement age because people are living longer and healthier lives. So what will you do if you are in retirement for 25, 30 years? I mean, you're still able, and that's why in OECD, because of the declining proportion of working age group, they're now trying to extend the age of retirement. But of course, there's a lot of resistance because people there just want to get their pension and enjoy their life. But it's not sustainable also if you have a significant proportion of the population in the elderly ages and the pension system is going to collapse. So those are the things that planners have to think about,
Thank you so much. And maybe the response to your question of the advice to senior citizens who will go on Sunday, don't forget to bring their maintenance medicines. It's okay. Do you still have something to say? Oh, it's all right. Can we still accommodate questions or? All right. Maybe the other one here. It's the final question.
It was mentioned in one of the presentations that there were like 5 disciplines that we have to take into account. The philosophy, sociology, I forgot the other 2, but I failed to hear something about the economics of aging. Can you say something about that, please?
Of course, economics is everything. We'll decide everything. But I'm, I think that we are doing, I'm so happy to have met this group of researchers. And I did speak at UP Manila when I just first retired. And they wanted for me to share what am I doing after retirement, busier than ever. But let me tell you, when I was in Harvard, my mentor was Howard Gardner. If some of you know him, he's the proponent of multiple intelligences. And he will be holding an AI podcast next week. But let me tell you that during that time at Harvard, they were deciding whether there should be mandatory retirement or not. And so there was a great discussion among the faculty members. And they felt that after retirement, because here in the Philippines, 60, right? But for government officials, we are 65. So I'm beyond 65. And so they decided not to impose mandatory retirement for Harvard faculty. And they worked on a research which I was able to join and look at the results. Those who retired because of mandatory retirement became happier, actually. But their happiness is with relationships, with grandchildren and so on. But they found those who stayed and continued to teach become sharper than those who decided to retire. Because they stayed active cognitively, so their minds were sharper than those who decided to retire. So that's my goal, to still be active mentally, cognitively, so that I can stay sharp and not just staying home and be happy with children and grandchildren. So maybe that would count.
Yes. I just came from the ASEAN policy planning meeting on aging, and we are now at the care economy. We are now discussing economics at a care state. I don't know, I'm not an economist, but most countries in the ASEAN are now taking care of aging people in other parts of the world. And so we now have to look at our economy as a care economy, not just as a service, but particularly as a care economy. So we have to look at that. But we have just started a research program on employability and employment for older people beyond retirement. So this was just recently accepted as a paper and funded. So you will hear from us maybe in a year. But yes, we agree that we have to continue to be active, whether paid or unpaid, whether with salary or not. No, older people want to contribute and remain productive.
Thank you, Dr. Shelley. Again, for those who have questions we were not able to accommodate, please register to our organizing committee for the fire chat, part of the program outside. So I think to close this program, I started with the question, how do you imagine us? And maybe 5 years is too fast. No, we can imagine broader than that. Now, maybe really, and you will agree with me, panel members, that the vision that we would like to have is a vision that all of us will age, not only actively, not only healthy, but graciously. All right. Thank you so much. And thank you to our panel members and to those who asked questions. And we're now ready for the photo opportunity. Thank you po. Thank you so much, Dr. Grace, Dr. Shelley, Miss Angely, and Dr. Ku. Thank you to our speakers for closing today's plenary sessions with such insightful, meaningful discussions, I should say. And we have seen how artificial intelligence can really support aging societies. But we have also been reminded that policies must ensure these technologies are inclusive, ethical, and responsive to the needs of our most vulnerable population. So again, a round of applause to our speakers. This brings us full circle to our conference theme, Reimagining Governance in the Age of AI. The challenge is not about adopting technology for its own sake. Kanina pa nating narinig to. But about shaping policies that put people first. With that, we now move to our closing plenary, where we will hear a synthesis of today's rich conversations and reflections on how we can carry these insights forward into research, policymaking, and practice. I'm now turning over the microphone to our department manager, my friend Melinda Quinones.